Thank you, Mr. Chairman. Mr. Secretary, welcome, and thank you for the role that you're filling. I've just got a couple areas. One, on an item you just mentioned, that every private sector referral triggers 7 additional visits. If you would, and you can have Dr. Clancy do this, I would love to see the data on that. I know that that's what VA actuaries have stated and what they believe. I think we need to get to the bottom of it, figure out why. Is this a contractual problem where we've contracted with a private physician where they see an opening to bring a patient back 7 times? Under Medicare, that would all be under a bundled payment. If we're going to do private sector right, then we've got to figure out whether we're doing it right today. But I can't envision where every time we referred somebody to a private sector doctor, it triggers 7 additional appointments, visits that we're going to pay for. And if that's the case, I would love to see the specifics on that when you're able to do that. With everything that you just went through, it's probably hard to believe that I'd ask you this question because you detailed greatly all the changes that we're making. But my question is this: how do you plan to change the culture at VA, and how do you plan to measure it?
First, we will get you the data on those 7 visits. As you know, many of our veterans have multiple illnesses, but we'll get you the data, and we'll sit down together and talk about that. In terms of changing the culture is probably one of the most difficult leadership challenges, whether it's in the private sector or the public sector. I think the most important thing we've got to do is to open up the culture. As I described earlier, high-performance organizations have the improvements made by the employees, not by the leadership. The leadership certainly helps. They pick the strategies, they pick the leaders, and they help create the culture. But we've got to get every employee involved. So on the very first week, I met with the union leadership. The majority of our employees are union members. About 65% are union members. I met with the union leadership, and I've met with them 3 times in my first 5 weeks. And I'm asking them to recommit themselves to our values, our mission, and to help me engineer the changes that we need to make. Every time I go to a site, I meet with the union leadership as well. I include them in our leadership meetings. I also make sure I talk to the whistleblowers from that site. And I always do a town hall where I explain to the employees that I want every employee to be a whistleblower. I want every employee causing us to change. I've used a diagram. I used it yesterday, and I've used it with employees that basically says that most people think of an organization structure like a pyramid. At the Procter & Gamble company, you would have a CEO. At the Department of Veterans Affairs, you'd have a secretary. Well, I take that and I turn it on its head, and I say, this is where our veterans are. Our veterans are at the broad base of this pyramid. The people caring for those veterans are the most important people in the organization. I'm on the bottom. I'm at the apex, and what I've got to do is make sure the communication is flowing up and down that pyramid to make sure we care for those veterans. So the boss of this operation is the veteran. The boss is the person next to the veteran, serving the veteran. And frankly, some of the things that have happened in the past don't fit that picture. For example, we had some of our positions who served the veteran downgraded. And the annual salary is tens of thousands of dollars less that we're able to pay them. Well, those are important people. We've got to, so I've encouraged all of our leaders to seek exceptions to that policy, and we've got to get back to putting the best talent up working and serving the veteran. Culture change is difficult, but I think we can do it.
Go ahead, Dr. Clancy.
Just to make one point, when your point about measurement, VA has a unique all-employee survey, which is now going out into the field to all employees, and it's much more thorough than other federal departments. And one of the areas that we can measure and do track closely is psychological safety. In other words, do people feel empowered to say, we've got a problem here on the front lines, I need help, this isn't working. So we will be keeping a very close eye on that.
Good.
Yeah, we sent that out last week, and I would be happy to share the results with the committee when it comes back.
Thank you. One last question. In the press release that VA sent out prior to the release of the IG's report, The release stated that you had asked for an independent review at scheduling and access practices beginning this fall by a joint commission. I've got a very simple question. Why? Why do we need a joint commission to look at the same thing that the IG is looking at in 93 facilities right now? The IG has reported on since 2005, and are we waiting till the fall to implement changes in that until we've got a joint commission's report back?
I'll ask Dr. Clancy to clarify my comments, but it's not just any commission. It's a commission that does this kind of work for a living.
This town's full of commissions, and as soon as we hear the word commission, boy, we all start looking for who's hiding.
It's not about hiding. It's about benchmarking best practices. And this commission does this across the country and will help us understand best practices in all facilities, not just the 93 that the IG is looking at. So we plan to use this commission to improve. It's unfortunate their name is commission, but that's...
So just to expand for one moment, they do accredit the vast majority of private sector hospitals. In fact, they cannot get paid by Medicare or Medicaid if they're not accredited. So this is following a standard practice in the private sector. These are going to be unannounced surveys. So we have put a huge amount of effort into making sure that the schedulers are trained, that we have enough people hired. We're looking for ways to get exceptions to get their grades increased, as the Secretary just indicated. But this is also going to be looking at, is it really working? How does patient flow work? What happens to people who wait in the emergency room who leave because they've been waiting too long, and so forth? So it's going to be an independent check for us, and it will give us an opportunity to spread both good practices and opportunities for improvement across the system.
Thank you.